How are you, Brenda?
I'm fine.
I have seen your photographs. You look good.
Thank you.
How do you feel about yourself?
I feel good. Healthier, younger, more beautiful. Yeah.
Briefly introduce yourself, your profession, your education background.
Okay, my name. You want me to look at the camera or her? Whichever. Okay. My name's Brenda. I'm a lawyer by profession, and I'm 37 years old now. Yeah, I live in Nairobi and work in Nairobi. Yeah.
Yeah, you started the weight loss program in 2009.
2009 December. Yeah.
How many kgs have you lost since then?
To date, 22 kilos.
22 kilos.
Yeah.
Wow. And in the first month from your file, I can see you lost 7 kgs.
Yes.
That must be. How was the feeling? It was brilliant.
Yeah, it was excellent. When I started the program, I was having difficulty breathing. I couldn't climb the stairs comfortably without panting. I couldn't walk long distances without sweating excessively. So the first month was quite good because immediately I felt a difference. I could, climb stairs better without panting. The sweating reduced and I started feeling lighter. I was having problems before, so with time it has really gone.
So by the second month, everything was, the advance was very good. Because the second month you lost 5 kgs. So within 2 months you were very good.
Yeah,
there was progress.
Yeah, within the 2 months there was a lot of progress. I had changed half my wardrobe because my body had started changing. I was on high blood pressure medication, so when I started the program, the doctor was monitoring my high blood pressure medication. So I think with the second month we had reduced the dosage by half. So I was already on half the drugs I was taking.
So you still take the drugs?
No.
The problem you don't have it. So less medication for you for now.
Actually I hardly don't take medication now.
But before you used to
I had to take every single day. I couldn't take a day without taking my hypertension medication.
Okay.
Yeah.
And how comfortable are you with your maintenance, the methods you use in maintenance of your weight?
Right now I am comfortable because over time it's about 3 years now. Almost. But with time you get used to it, so
it becomes your new lifestyle.
Yeah, it becomes a new lifestyle. So you really don't even think much about it. But it's part of now what you do. So it's not an effort at all.
How are you enjoying your new status, your new weight?
I'm enjoying it a lot because I think I still look at myself in the mirror and I'm like, am I dreaming or I'll wake up and find myself where I started? Because it's a process, so by the time it happens gradually, you sort of find yourself in it, like you've moved from this to this. So definitely, I think I'm happy I can get clothes now that fit me better. Before, you go for shopping and you really want something and it's not in your size, so you have to settle for what is there. Now I have a choice to wear what I want and also look good in it, without being conscious that it's almost exploding out of what you're wearing. So yeah, I think it's a good feeling. Yeah.
And you must have gotten many comments, positive, negative. People will always be people. So there are some who are positive and negative comments.
Definitely. I think what is important is when I started the exercise, we had a very candid talk with the doctor, And one thing that was very clear was you have to do this for yourself, not for anybody else. Because if you do it for yourself, then you'll go through all these positive and negative compliments without them affecting you. But if you're doing it because of somebody, if you don't end up getting the sort of reaction you expect, then it can let you down and you can go back because you feel let down. So when I started the program, when I came here, I came because I didn't like what I had become, and I had made a decision to take charge of my health. So I was doing it for myself. So when I started losing weight, of course people started noticing, and I got, as you say, positive and negative comments. So positive were like, wow, you know, you're looking, you're getting slimmer, you're getting, you look better in clothes. Good compliments. And of course there were the negative comments that, are you sick? What has happened to you? Are you stressed? Are you depressed? So you have to be able to handle those comments so that they don't affect you in a way that the negative comments don't make you stop the program. Because at some point when I had lost almost 15 to 18 kilos, everybody was like, you're sick. You're sick and you need help, and So if you don't know why you're doing it, you start eating again to gain the weight, because people acknowledge sort of big people with health. So the minute they see you going smaller, then they think something is wrong. So you will go back
to the
eating. Yes, you will go back, because when people start saying you are sick, it gets to your mind and you're like, gosh, I look bad because maybe now I'm too thin, and some of them would come and say, oh, your bones are sticking out, and so you start feeling, no, let me eat and add a bit more weight so that I'm okay. Then you start eating back, But at the same time, if you also get too many good compliments, it gets to your head and you're like, oh, okay, I've reached there. Then you stop what you're doing and start eating again and then go back there. So if you're doing it for yourself, then you're able to manage those both negative and positive, because both of them can affect you to go back. Exactly. Because if you're not doing it for you, then you're doing it for everybody else. So when they tell you good things, it gets to your head, you can't sleep. If you're doing it for other people, they tell you negative things, it affects you, you go back. But if you're doing it for yourself, when you get good compliments, you're happy, but it doesn't change, because at the end of the day, it's you. So whether it's negative or positive, you're not doing it to please anybody. So whether they like you or not, it's their opinion, so it doesn't affect what you're doing.
Yeah. And there are some of your friends who don't believe that you'll be able to maintain. Some are like saying, we'll give you like 10 years to get back to where you are. We'll give you like 15 years. What do you tell them?
Starting with myself, I didn't think I would maintain, to be honest, because what happened was, at some point, of course, there are these situations you'll find you've slightly added weight, you've come back, but you have to now know how to control or maintain. You of course reach a situation where people start telling you, okay, everybody loses weight, it's normal, but they regain it as fast as they lost it, and it comes back times 2. Okay, so of course you sit there and they're like, okay, this will come back times 2. So you have that apprehension. But I think for me now, I've taken this long, and those who are doubting have waited, and they're like, what happened? How come you're not going back? And they get very fascinated, because when I started the program, the first month, the discipline, before your body really gets into the system, you have to be very disciplined, Once your body gets used to it, and the beauty about this program, it's not a diet. You're supposed to, you can eat what you want to eat, but you have to know what to eat and how, the quantity. So sometimes you can go out and you know, you eat something and everybody stops eating and they're like, you're eating that, how come? And I'm like, yeah, I can eat. Doesn't mean that if you're in this program, you're on a special diet, you lead a normal life. So they still get fascinated. I can take an ice cream once in a while and everybody will be like, why? It's like then tomorrow they're watching to see like if you've added 10 kgs. It doesn't affect that because you have to know when you can eat that, take that portion, which treat yourself. But of course, the bigger bit of it, you have to have the discipline. So it's not that you eat it every day, but if you eat it once in a month, once in 3 months, it doesn't have effect. So they look at that and they keep getting fascinated. Like, you can eat this and you're still like that. How come it's not working? Well, so they get fascinated.
Okay, so you mentioned earlier that you had some health problems. Your high blood pressure was high.
Yeah, I had extreme hypertension, and I would get admitted, like in a year I would be admitted almost 3 times. Just
so it was serious?
Yes, it was serious. And as I said, I had to swallow medicine every day. And in case I forget to swallow the medicine, I have to send somebody to go and pick it from the house because I would be very bad, it would shoot up. I couldn't drive long distances. Really, I couldn't drive out of Nairobi, so I could only drive within Nairobi because if I go long distance, then I would, like there's a time I drove to Naivasha and got an attack on the way to just black out. Like they're alone on the highway, so I'd stopped driving long distance. Now I drive even to Kisumu, so that's changed because I'm okay now.
No, the weight after you lost your weight.
Yes, after I lost the weight, I can now drive anywhere.
You no longer pant when on staircases.
No.
You don't have severe headaches.
No, I don't have severe headaches. I don't have knee pain. I don't have back pain. It's that all cleared.
Just by losing the weight.
Just by losing. Yeah, that's just by losing weight.
Did you try other methods of weight loss? Like there are 1,000 methods of losing the weight. People go to the gym, people use food supplements. Did you try other methods?
I'm not a gym person. I'm not those fanatic, like regularly daily gym people. I go once a week or twice, but very light. So now I'll do more of walking and more of the physical sort of exercise. But prior to coming for this program, I think I just tried the diet, not supplements, but I would diet, I would miss lunch, I would miss breakfast, I would take water, I would take strong lemon tea, I would take all the normal dietary stories you hear.
Did they work?
Yeah, they would work. I would lose 3 kilos, 2 kilos, then it comes back. So it wasn't permanent. So that was the frustration. So you'd lose, when you're on the diet, you'd lose. Then once you go back, it comes back. So, you stop the carbohydrates, starch, you go on a protein diet, but it wasn't really, it didn't, no.
But the treatment in holistic living farm is stable since you started?
It is stable because what has happened is I've lost the weight, currently 22 kilos, and it's out. It's not come back. Of course, depending on circumstances, because I also travel a lot in my work. So when you're out there, sometimes you can't control what you're eating because you can't control who's cooking it. You're staying in a hotel. So you'll come back, you find you've added 1 kg, 2 kgs, 3. But immediately you are back home in a comfort sort of environment. It doesn't take me a week to lose it. And because with no effort, I'll just go back to my normal diet and the weight comes out. So it stopped bothering me, like, when I traveled, you have to live this way or this way, because the minute you come back, it just goes.
Okay. And why do you think the methods that are used in the holistic living farm are the most effective, safer, and stable methods in the weight maintenance, since we use various medical treatment, we use psychotherapy, calorie counting, the calculating the food?
True. In the first place, what attracted me to this program was when I first came, the doctor was very keen in finding out my medical history. So we did not just start off on calorie count, you know. We sat down and she wanted to know, okay, you've been hypertensive, what medications have you been taking, what tests. She even sent me for more tests, actually, before we even started the program. I had to go for a series of tests, which now she analyzed before knowing what I should get into. She looked at the medication I was taking, the hypertensive medication. She recommended also, you know, so that when we started the program, I started reducing the dosage. She's the one who recommended that, you know, at this point now, go into half. Of course, I was scared and I was like, I've been taking this whole dose, you're saying half, but I trusted her. I think one thing that happened was we also were able to trust each other from the word go. So for me, I think that won me over because I realized I was being handled by a specialist, somebody who knew what they were doing, and somebody who had some medical background. So it was not just a nutritionist telling you eat this, but she was also approaching the whole thing from a medical point of view. So when we started the program, she told me, okay, you need to go for psychotherapy, you need to go for calorie counts, you need all this. So she told me why I needed to go for that. And I think apart from the calorie counting, which I'm sure everybody does and knows, for me, what was quite unique was the psychotherapy. Because during the program, I would go through psychotherapy sessions, and inevitably after the program, she gave me the tapes to be listening, which I still do, because there are those times you sort of start, you know, going down, and you need that to bring you back, like, so they really, really help, and they stick, you know, and they really stick in your mind more than if you read something in a book, because it really works on your mind until you look at some things you used to do and remember the tapes and you will not approach it, you know, you look at it and it sort of keeps you away. So that for me was quite useful in especially when you start the program, you need that psychotherapy to take you through it because you're fighting a will. There's a lot of, you know, challenge. You're trying to change your lifestyle. You're already used to this lifestyle. So you need something that can motivate you to do what you want, to do the right thing. So if that psychotherapy is not there, yeah, sometimes it's yeah, because you'll be like, okay, let me just eat it after all, you know. But when you have the psychotherapy, then it keeps playing in your mind, and sometimes you find you've just gone to grab something and you leave it, and you're like, it's not worth it.
And the better part is that they're in CD form, so you can just always play it. And
I carry mine in my car. In fact, when I'm driving, when I'm stuck in traffic, that's the best time I listen to it because they're quite long sometimes. They take, it's a whole session. So if you really need to get through to the session, then that would be the best. And with Nairobi traffic, you'll go through a tape like in every day. And it really helps to push you through.
When you started the weight loss treatment in Limo House Hospital, there was only one method used, the medical treatment, what you used.
Yes.
Now there are two methods. There is the medical treatment and then the surgery part. The doctor uses it where there is severe cases. The doctors work on it. There is bariatric surgery and gastric balloon. It's where the patient, the obesity is very severe. The doctor has to do the surgery. And the surgery, most people fear the surgery, but the risk of the surgery and the risk of obesity, the risk of the surgery is much less. While with obesity, you will have a lot of problems. Since there are many causes of obesity, there are like more than 17. And you'll have problems, your blood pressure will be up, you will have headaches. So the risk of having the surgery is a bit less. Yeah, it's minimal. Yeah, so what do you think about the bariatric surgery, the second method? You see, and it's 100% effective.
Okay, I'm not a medical person, but just from the layman's point of view and talking to the doctor, they are normal people. You know, like I would say, I'm lucky I fall in the normal group, yeah, whereby the first method will work for you. If you get into the calorie counting and the first process and you see the results. However, there are cases where there's a lot of resistance. So in spite of doing the calorie counting, the psychotherapy, it doesn't help. It doesn't work. And depending on your body and the level of obesity. Now those people then would need to look for something else to really help them out, because if this first stage can't work, then they have to consider. And as you've rightfully said, surgery, I mean, we all fear surgery, of course, for obvious reasons, but if you look at the risk of carrying obesity and what comes with obesity, you know, everything associated with obesity.
Yeah, yeah, social
At the end of the day, honestly, it's worth the risk. Yeah, and I've not heard also, still from a layman's point of view, I've not heard of any cases where somebody has gone for the, you know, the cases you're talking about, and there's been any major drastic reaction or death or anything. So it's surgery like any other surgery, but for the better, because if you look at, I used to spend like 5,000 minimum on medication on my hypertension, you know, on a minimum. Because some months it would go up depending on the number of doses you needed to take. Now, if you look at 5,000 for a year, the amount of money you're spending, not forgetting you've gone for all the other associated factors to treat your obesity. You know, the sort of implication of what you'd be sorting out if you really got the procedure done and staying the way you are. One outweighs the other.
Yeah, it's more expensive to remain obesity.
Definitely.
Not.
And to shorten your life. Bottom line, I say life is not a rehearsal. So if you're obese and you get a heart attack or a stroke and you drop dead, that's it. You won't wake up and say, okay, let's try again. So get a healthy life, prolong your life, lead a healthy life, and enjoy your life. Because if you're obese, you will not enjoy your life. You'll be sick. You'll be having all these complications, you can't do this, you maybe enjoy doing something you can't because your weight, your health doesn't allow it. So you become like a prisoner to your body.
Yeah, and looking at it, most people try to avoid the obese people. You see, like your friends are avoiding you when they go for social gatherings, no one wants to associate with you. So your life becomes a bit lonely. So
yeah, and I think also the sad thing is, as an African culture, we encourage obesity. You know, because I remember, yeah, when I was a child, you know, my mother would feed us. You know, she'll serve you food and you have to finish it. So you'll sit and eat it until you finish. Whether, you know, sometimes you are so full, but because, you know, when you see a healthy, fat, nice, round child, they look nice and cuddly. So then people compliment the mother. But the problem is, if you don't know where to stop also as a parent, then you start bringing up obese children and they become obese adults, and that's, you know, for no fault of their own. So the problem of society, even for young children, you know, those children get mocked in school, people laugh at them, so they really grow a life of victims, you know. And even as an adult,
you carry that with you.
You carry that with you. Your self-esteem is not there, because every time people look at you, they just think you're greedy. You're just eating every time. And sometimes, honestly, well, it could be genetical, it could be food, but I mean the fact that people see you're big, it's food.
Yeah, people don't understand where it came from.
You know, you try to get into a matatu, sometimes they refuse to carry you because you're occupying 2 seats.
Yeah, or they tell you to pay for 2 seats.
Or they tell you to pay for 2 seats. So you get humiliated every step you turn. So there's no joy really carrying it around, if you ask me.
And what would you like Holistic Living Farm to do to improve the program, the weight loss program?
I think it should reach out to more people, because at the moment it's really confined. It's more, okay, I learned about it from the newspaper. I was reading the newspaper and I saw an advert, and that's how I decided, because at the point I read that advert, I had really had it, and I was looking for a solution, you know. So I thank God I did take the decision. But remember, there's so many weight loss programs out there. Right now, everybody's talking about the same thing. So if I think there's need for more, you know, aggressively market, so that people are able to appreciate that really there's this works, and this is not the normal weight loss, because everybody is advertising a weight loss program out there, and so many people have tried and gotten frustrated. So when they see another one, they're like, what's different? So I think this program needs to sell itself like what's different, because it has a lot of success stories, I being one of them, and success stories because it's a program that stays, you know. It's a weight loss that is there to stay, because now this is me 2 years, almost 2.5 years later, still there. So it needs to reach out to more people in a way that it's unique, you know, because it's not just a normal any other weight loss program. So probably I don't know how, maybe the marketing key way to reach out to more people, use more, you know, but just try to stand out among the rest, because, you know, sometimes people look at me and they're like, Brenda, what did you do? And I keep telling them, I'll give you the card for the person who did this, because I can't tell you what I did, because that's also a problem with people. They want a shortcut. They don't want to go through the process, but they want the end result. So they're like, okay, give me the psychotherapy tapes to listen. And I tell them, even if you listen, without going through the program, without doing the calorie counting, without supplementing the whole program, you can listen to that tape from morning to night, it won't change, because you won't be understanding what that message is. So you need to go through the program. There's no shortcut that, because Brenda has gone through it, Brenda, come and tell me. I'm not the professional here, so I can't tell you, you know. So that's what also people need to learn. There's no shortcut. You have to go through it. For you to see the results and to see positive results.
What advice would you give such people? If people are adamant to come for the procedure, for the weight loss?
What I tell them, because there's the issue of cost, and most of them are like, first of all, the cost. So what I tell them, if by the time I made the decision, I calculated the amount of money I was using per month, okay, and I decided, let me make this decision and sacrifice. And it has paid off, because, yes, I paid, but how much have I saved in the last 2 years? It's going to, yeah. So at the end of the day, let's focus on the long term, because sometimes if you focus too much on what you have to do now and spend now,
one should focus on the end results. Exactly,
because at the end of the day, you might refuse to pay what you're paying now and remain obese and continue spending 5,000-10,000 a month, continue with all the complications of obesity. So what are you saving? You know, so people should, health is expensive. And the sad thing about your health is you can't replace it. So the sad thing is you have very rich people bedridden. They can't buy their health back. So if a point comes where you have an opportunity where you have to invest in that health at that point to get a long-term benefit, it's more of a common sense approach. But it's as I've said, it has to come from you, because if you're also doing it because Brenda did it, of course you'll come and you'll be told the cost and you won't be like, because it's not what you want. You are here because you've seen that and you think you want to get it. So it has to be a personal conviction, and then you'll be able to do it, because nothing is impossible.
What wish would you wish for the holistic living farm, since they helped you, the doctor helped you in the weight loss treatment? What wish would you wish the doctor to do more for others, for those who are adamant, as I said?
Okay, I know the doctor is busy, she's very busy, but I think she should also create time to give back to the society in her own way, because one of the outreach things I'm saying, maybe even to sell the program, is getting involved in talks, giving professional advice. You know, she could be invited to some forums where she could be able to talk and just take people through the programs, maybe have a person like myself accompany her to show that, yes, after saying all this, this is the result. Then that way she can reach more people, because if at all, let's say you went into a workshop that had 50 people and you gave a talk about your program, 5 people will pick it up seriously, leave the 45 who might not. But in every session you have time to spend with people, just talking, it's free. You will still reach out to people. Then that way you also sell the concept, as opposed to just limiting it on advertisement or media or what. So just spending more time on more interactive section, because that sells itself. And when people start relating and talking, oh, do you remember about the session by this doctor? Oh yeah, I also had it, and then it sells itself also faster.
And in this case, as we all know, it's not a hoax, it's real. So if anyone is in doubt, they can always come and see all the results.
I think for me, when you start the program, the doctor is also very open, because there are photos of people who've gone through the program. Of course, initially you'll say there are photos, anybody could have posed for that photo, fine. But you have to have the conviction.
Because it all begins with you.
It all begins with you, because even if you look at Brenda now, if you're not convinced, it doesn't change. Okay, so I think it's from the success stories so far, then definitely it's not a hoax. People should be able to look at it and try it. And well, it doesn't cost you anything to try it and see.
What would you like to tell anyone that will be listening to this or watching to it?
I would encourage them to try. I would definitely encourage, if there's anybody out there who is having obesity problem, or, well, obesity, sometimes if you use the word obesity, it sounds extreme. Say overweight, yeah? Because when you say obesity, everybody will tell you they're not obese, you know, so they think it's for the extreme. So say overweight. If you're overweight and you feel you need to do something about it, you've reached a point where you need to do something about it, then give it a try. Because I'm sure everybody who's overweight has tried one way or the other losing weight. So there's nobody who has not gone through the process. And yeah, this is something new, this is something different. Yeah, worth giving it a try.
It worked for you, so it definitely worked for the other person.
It definitely worked for me, and yeah, I'm still in the program very much, and
after
still raring to go after 2 years, going into the 3rd.
Just positive.
Yeah, yeah. It's all here and here. So once you're able to reconcile the two, there's nothing that you can't do.
Thank you very much, Brenda.
Thank you. Another thing is that with this program, I lost the 22 kilos without getting any stretch marks. So that has been a very fascinating thing for me also, because I was expecting, you know, by the time your body shrinks to the level it has shrunk, then the stretch marks would be all over. I can assure you that I have not gotten any stretch marks. My body shrunk naturally in a way that there was no stretch marks at all.